Good afternoon. Today we're going to be learning about EpiPen as well as how to administer EpiPen and why and what signs to look for. EpiPen training for Texas childcare programs to ensure safety and preparedness in childcare settings. In this training, we will be reviewing what is anaphylaxis, the signs and symptoms of it, as well as about the EpiPen and epinephrine, when to use an EpiPen, how to administer the EpiPen, steps after the EpiPen has been administered, and Texas childcare legal considerations, storage and documentation requirements, practice scenarios, and at the end, key takeaways. EpiPen training for Texas childcare programs. In this training presentation, which is designed to prepare us, our childcare staff and dear ones, Texas to respond confidently and appropriately to severe allergic reactions using the EpiPen or other epinephrine autoinjectors. Allergies and anaphylaxis are increasingly common in young children, and childcare providers are often the first adults responsible for recognizing those symptoms, and taking the life-saving actions is one reason why I included the pictures of some of the symptoms for you. The purpose of this training is also to ensure staff understand what the anaphylaxis is and why epinephrine is critical, and how us in Texas child care regulation guides safe and lawful response towards it. The presentation emphasizes that epinephrine is a rescue medication, but is not a substitute for emergency medical care that they would need even afterwards, and that rapid action can save a child's life. It also frames EpiPen use as part of a broader safety system that includes allergy action plans, communication with families, proper documentation, and compliance with Texas Health and Human Service Commissions and Department of State Health Services guidance. By the end of the training, staff should feel empowered rather than fearful, understanding that Texas law supports trained caregivers who act in good faith during an emergency. This slide sets the tone by clarifying the audience, childcare staff, and reinforcing that the goal is safety, preparedness, and compliance, not the medical diagnosis. It also highlights that this training will support both assigned epinephrine for individual children and, where applicable, voluntary participation in unassigned epinephrine programs allowed under Texas law. The objectives of this training are structured to build knowledge, confidence, and practical readiness among our staff. And first, staff will develop a clear understanding of the allergies and anaphylaxis, including how quickly those symptoms can escalate and why early recognition is very essential to save the child. Second, the training will focus on recognizing the signs and symptoms of a severe allergic reactions across multiple body systems, emphasizing that anaphylaxis can look different in each child. Third, participants will learn when and how to use the EpiPen correctly, including safe administration techniques and common mistakes to avoid. Fourth, the training explains Texas-specific childcare requirements, including voluntary policies for unassigned epinephrine autoinjectors, staff training expectations, storage rules, and parent notification requirements. Finally, staff will learn what steps must be taken after epinephrine is administered, such as calling 911, monitoring the child, documenting the incident, and communicating with parents regarding it. This objective ensures the staff are not only technically trained, but also understand their legal responsibility and the importance of teamwork during emergencies like this. By clearly outlining these goals, the training sets expectations and reassures participants that they will leave them with practical, applicable skills they can use immediately in real-world childcare settings. Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur rapidly, often within minutes of exposure to an allergen. In childcare settings, common triggers include food such as peanuts, tree nuts, milk, eggs, and shellfish, as well as insect stings, medications, and latex. Anaphylaxis is dangerous because it affects multiple body systems at the same time, which can lead to airway swelling, breathing difficulty, a sudden drop in blood pressure, and loss of consciousness. Young children may not be able to clearly explain how they feel, making staff observation especially important. This slide emphasizes that anaphylaxis is a medical emergency and should never be treated as a "let me just simply wait and see what happens next" situation. The only first-line treatment for anaphylaxis is epinephrine, delivered promptly through an autoinjector, such as Benadryl. Do not stop anaphylaxis and should never delay epinephrine use. Understanding that anaphylaxis is help Staff recognize the seriousness of symptoms and reinforces why immediate action is required in childcare environment where delays can have severe consequences. Signs and symptoms of the anaphylaxis. Recognizing the signs and symptoms of anaphylaxis is one of the most critical skills for childcare staff. Symptoms can involve the skin, respiratory system, cardiovascular system, gastrointestinal system, or combination of all of these. Skin symptoms may include hives, itching, flushing, or swelling of the lips, face, tongue. Respiratory system often include coughing, wheezing, shortness of breath, chest tightness, or noisy breathing. Cardiovascular signs may involve dizziness, pale or clammy skin, fainting or confusion caused by low blood pressure, and gastrointestinal symptoms can include vomiting, diarrhea, or severe stomach cramps. A key teaching point is that involvement of multiple body system or any breathing or circulation problems should be treated as an emergency. In young children, symptoms may present as sudden behavior changes, lethargy, or distress. This slide reinforces that staff should trust their instincts and act quickly as possible, as early epinephrine administration significantly improves outcomes. Should you have a child that is showing these symptoms, call out for your admin emergency in infant one right now. The EpiPen is the brand of epinephrine autoinjector designed for fast, simple use in emergencies, which is a hormone and medication together that works by opening the airways, reducing swelling, and raising blood pressure, directly counteracting the most dangerous effects of anaphylaxis. This slide will explain that epinephrine is safe when used as directed, and that risk of not giving epinephrine far outweighs the risk of giving it when anaphylaxis is suspected. It also clarifies that epinephrine is a temporary measure, buying time until emergency medical services arrive. Child care staff should understand that different brands of autoinjectors do exist, but the purpose and principles for all are the same. Emphasizes how epinephrine works, helps reduce fear and hesitation, which are common barriers to timely administration in emergency situations. Knowing when to use an EpiPen is just as important as knowing how to use it. Before we get to that, note that anytime you have a child that is enrolled with allergies, we are required to have a form filled out, which is for severe allergies, by the parents and the doctor with plan of action and their signature from state of Texas licensing. All others, intolerances and everything else is to be recorded on the admission form, but severe allergies has a specific form that needs to be filled out and must be on the file, and communication needs to take place between the staff as well as administration. This slide will stress the epinephrine should be administered immediately when anaphylaxis is suspected without a doubt, even if staff are unsure. They don't know. Delaying the treatment can observe symptoms can increase the risk of severe outcomes. Staff should follow the child's individualized allergy or emergency action plan on the severe allergy form whenever one is available, which in our case, it must be available, but lack of plan should never prevent action in an emergency. The training reinforces that epinephrine is appropriate when there are breathing difficulties, significant swelling, signs of shock, or multiple symptoms occurring together. This guidance aligns with national medical recommendation and Texas training resources, helping our staff feel confident that prompt action is both medically correct and legally supported. How to administer an EpiPen. Remove the autoinjector from its tube and take off the safety cap before use. Firmly press the orange tip against the outer mid-thigh through clothing if necessary. Hold injector in place for required 3 seconds, then briefly massage the injection site. Keep control of the child during injection to prevent any other injuries and reduce the anxiety. Ask for help if needed. Key rule to remember is blue towards the sky and orange to the thigh to make sure that you are not injecting EpiPen to you rather than the patient. Steps to take after EpiPen administration, which are not suggested but required. Always call 911 immediately after the EpiPen has been used, even if symptoms do improve, to ensure the timely medical assistance has been allowed to the child. Keep the child calm, monitor the breathing, contact the parents, and position them comfortably until the help arrives, as well as write the incident required form. Inform the parents or guardian as soon as it is safe to keep them updated about the situation. Ask for another person to help you with this. Be ready to administer a second dose if needed and prescribed, and properly document the incident for medical records and communicate with the medical authorities. Even though the state of Texas law allows us to have an EpiPen on the premises, not given to us by a parent, and administer it to anyone showing symptoms to save a life, Dear One's Daycare does not have any EpiPen like that unless provided by the parents to administer the medication for the children to save their life. Besides our medication administration policies where staff are not allowed to administer any medication unless admins, this is one exception we're willing to make in order to save a life. All staff, as long as they have taken this EpiPen training, can administer and give this EpiPen to a child in the event to save their life. Storage and documentation requirements. Proper storage and documentation are also essential components of EpiPen safety in childcare settings. Epinephrine autoinjector should be stored in a secure but quickly accessible location, protected from extreme temperatures and checked regularly for expiration dates. Center must maintain up-to-date allergy action plans given by the doctor and parent signatures, staff training records, and incident reports. Documentation ensures continuity of care, supports regulatory compliance, and provides critical information for families and healthcare providers. Emphasizing these practices helps staff understand that preparedness is an ongoing responsibility, not just a one-time training event. This scenario helps staff apply what they have learned in realistic, low-stress environment. A common situation such as a child experiencing a reaction after accidental exposure to peanuts or eggs, and walk through the appropriate response steps. Staffs are encouraged to identify symptoms, administer epinephrine promptly, and then call 911, notify parents, and document the incident. Discussing these scenarios as a group reinforces us to have teamwork, communication, and role clarity during our emergencies. This approach builds confidence among us and help our staff visualize how training translates into a real-life action in a childcare setting. This is the final slide. It is the most important message of our training. Today, you as our team should remember to recognize symptoms quickly, administer epinephrine without delay, which is our EpiPen, and always call 911 after the use. Following the Texas childcare policies, which is to maintain the proper documentation and communicate with families, are essential part of our responsible care. Preparedness will save life, and training confident staff make a critical difference during allergic emergencies. Ensuring that our staff will leave today with a strong understanding of your role and responsibility in keeping children safe in your care.